Hello, I'm Dr. James, a physician with over 30 years of experience specializing in men's health and healthy aging. Today, I want to discuss a topic rarely brought up in doctors' offices, and even less so in conversations among friends: masturbation after age 65. Is this truly a beneficial habit that can protect your health? Or are there hidden risks to your prostate, heart, or even your mental well-being? If this question has ever crossed your mind, know that you are not alone. Throughout my career, I have heard it many times, always whispered, as if it were a forbidden subject. But the truth is, the silence surrounding it only creates more misunderstanding. That's why today, we're going to have a frank, direct, and completely scientifically backed conversation. There will be no prejudices, no taboos, and no speculation. You'll learn about 10 real, scientifically proven benefits this practice can bring to your physical, mental, and sexual health. And at the end, I'll teach you a simple, quick exercise that any man can do at home to improve circulation, strengthen pelvic floor muscles, and maintain vitality and masculinity, even after 65. Let's begin. Number 1. Active and consistent prostate protection. For a long time, there was a misconception that masturbation could harm prostate health. Today, science has debunked this myth entirely. Years of observational studies show that men who maintain a regular frequency of ejaculation have a lower risk of developing prostate cancer and other related diseases. The reason is that ejaculation acts as a natural cleansing mechanism. It helps to expel old secretions that remain in the gland, preventing them from accumulating microorganisms, cellular debris, and inflammatory compounds that could, in the long term, damage prostate tissue. This physiological flushing also prevents chronic inflammation, which is a risk factor for various structural changes. Another important point is the stimulation of blood circulation in this area. When blood flow increases, more oxygen and nutrients reach the prostate cells, facilitating metabolic processes and the repair of any microdamage. It's similar to keeping a machine running consistently to avoid rust. The more smoothly it operates, the less likely it is to seize up or break down. Maintaining this habit at a healthy and conscious rhythm means investing in the longevity and proper functioning of the gland, preserving not only sexual health, but overall well-being. Number 2. Cellular nutrition and circulatory strength of the penis. Few men realize that each erection is essentially a complete physiological exercise for the penis. During this process, a large volume of oxygen-rich blood flows into the structures called the cavernous bodies, simultaneously delivering amino acids, vitamins, and minerals that nourish and strengthen the erectile tissue. This process is vital for maintaining the elasticity and expansion capacity of the internal fibers. Over time, if stimulation is infrequent, there is an increased risk of losing flexibility, decreased sensitivity, and the development of areas of fibrosis, which make erections more difficult. You can compare this to an irrigation system for a fertile field. When water flows regularly, the soil remains alive and productive. When the flow stops, the land hardens and loses its vitality. The same happens with penile tissue. Consistent circulation keeps it healthy and responsive. Furthermore, research indicates that sexual activity, whether alone or with a partner, stimulates the production of nitric oxide, a molecule vital for dilating blood vessels and ensuring more effective blood flow. In practice, each erection acts as a natural workout that supports vascular health and the organ's ability to respond, protecting not only sexual function, but also overall circulation in this area. Number 3. Stress control and heart strengthening. Retirement doesn't mean life becomes free from pressure. Health issues, family responsibilities, financial worries, and even sudden changes in routine can keep the body in a state of constant readiness. This chronic activation elevates cortisol levels, the primary stress hormone, which, if prolonged, contributes to increased blood pressure, worsens sleep, and can reduce testosterone production. This is where masturbation, often underestimated in health discussions, can play a powerful role. Orgasm triggers a series of physiological reactions that rapidly lower cortisol levels and activate the parasympathetic nervous system. This system is responsible for calming the body, slowing the heart rate, and creating a sense of restoration. At this moment, the brain releases endorphins, neurotransmitters that induce feelings of pleasure and reduce pain, and also activates areas associated with calm and a deep sense of satisfaction. This chemical chain not only helps you relax, but also improves heart rate variability, one of the most important indicators of cardiovascular health. Ultimately, if practiced with moderation and mindfulness, this habit acts as a programmed shut-off for the body, capable of relieving accumulated tension, calming the mind, and providing additional protection for the heart. Number 4. Strength and endurance of the pelvic floor muscles. The pelvic floor consists of a group of muscles and supporting tissues that hold the bladder, rectum, and, in men, the prostate in place. Beyond supporting these organs, this area plays a key role in erection quality and bladder control, both day and night. During orgasm, the pelvic floor muscles begin to contract rhythmically and intensely. This repetitive movement acts as a spontaneous workout that strengthens and improves the tone of these muscles. Over time, such stimulation helps prevent problems like urinary leakage, weakened erections, and a feeling of internal weakness. For men who already have some weakening in this area, which is common after prostate surgeries or during natural aging, these contractions act as a booster, accelerating functional recovery. Combined with targeted exercises, such as Kegel exercises, the result is stronger, more resilient, and more responsive internal support for years to come. And pay attention. At the end of this video, I will show you exactly how to perform this exercise correctly and safely. This isn't just about pleasure. It's a discreet and effective workout for an area directly linked to sexual function, urinary health, and overall quality of life. Number 5. Self-examination and early diagnosis. Masturbation, when performed mindfully, can transform into a genuine, intimate preventive checkup. During touch, you might notice changes that would otherwise go unnoticed in daily life, such as altered sensitivity, the appearance of small lumps in the testicles, painful areas, spots with a different temperature, or unusual curvatures during an erection. These observations are extremely important, as they can indicate problems at early stages, ranging from inflammatory processes and anatomical changes to serious conditions like testicular cancer or Peyronie's disease. The earlier these changes are identified, the higher the chances of simple, quick, and effective treatment without the need for aggressive interventions. Another benefit of this practice is the formation of a personal baseline. A man begins to understand precisely how his body reacts and can immediately recognize any deviation. It's like having your own owner's manual, allowing you to pinpoint exactly when something is amiss. This doesn't require equipment, clinic visits, or expenses. Just a few minutes of attention during a familiar activity that, besides pleasure, can literally save your life. Number 6. Pleasure chemistry at the service of health. Immediately after orgasm, the body triggers a cascade of biochemical reactions that positively influence mood, overall well-being, and even physical endurance. At this moment, the brain releases dopamine, a neurotransmitter associated with motivation and feelings of reward, which helps combat apathy and increases energy for daily tasks. Oxytocin, known as the hormone that fosters emotional connections and a sense of security, also kicks in, inducing calmness and reducing anxiety. Serotonin helps regulate mood and stabilize sleep, while endorphins, the body's natural painkillers, alleviate muscle and joint aches, bringing about deep relaxation. This combination creates a state of physical and mental equilibrium that extends far beyond momentary pleasure. You could say that after orgasm, the body switches to recovery mode, boosting internal defenses, balancing brain chemistry, and naturally replenishing energy without medication. Maintaining such a stimulus in a healthy and regular rhythm is a simple way to tap into your own internal pharmacy at any moment, one that operates 24/7 and is ready to care for both body and mind. Number 7. Reconnecting with your body and boosting self-esteem. With age, the body inevitably changes. Skin loses elasticity, hair grays, muscles may weaken. For many men, these changes are accompanied by emotional detachment from their own bodies, and in some cases, dissatisfaction with their appearance. Mindful masturbation serves as a bridge to restore this connection. It's a moment of personal intimacy that allows you to rediscover sensations, accept new physical features, and understand that, despite the marks of time, the body can still be a source of pleasure, comfort, and vitality. From a psychological perspective, this practice helps strengthen self-esteem and reduce feelings of devaluation that can emerge in older age. Men who lead an active sexual life, whether alone or with a partner, generally feel more confident, maintain better posture, and show greater willingness to participate in social and physical activities. Essentially, it's a reminder that the body is not just a mechanism that ages, but an ally that, with proper care and respect, can continue to provide quality of life, satisfaction, and energy for many years to come. Number 8. Enhancing restorative sleep. As we age, difficulties with falling asleep or maintaining continuous sleep throughout the night become more common. And it's not just about falling asleep. Deep sleep, the kind that restores tissues, strengthens the immune system, and replenishes mental energy, tends to become shorter with each passing year. Masturbation can aid in this process due to the release of specific hormones and neurotransmitters. Oxytocin promotes muscle relaxation and reduces activity in brain regions responsible for alertness and anxiety. Prolactin, in turn, is associated with feelings of satiety and the sleepiness that often follows orgasm, helping to prepare the body for deeper sleep phases. Additionally, the reduction in cortisol levels, the stress hormone, decreases physical tension and calms the mind, making the transition to rest smoother and more natural. This complex set of reactions creates internal conditions favorable for better quality, more stable, and truly restorative sleep. Frequent observations show that with moderate and balanced practice, this habit helps reduce the number of nocturnal awakenings and allows men to wake up more rested, without needing to resort to sleeping pills. Number 9. Maintaining desire and strengthening brain function. Sexual desire begins before any physical reaction. It originates in the brain. Images, memories, sensations, and fantasies activate specific neural networks responsible for initiating and sustaining arousal. When these connections are not regularly stimulated, they lose efficiency, making it harder to experience desire with the same intensity. In this context, masturbation acts as a kind of mental workout, keeping these pathways active and well organized. Each time the brain receives such a stimulus, the interaction between neurons linked to pleasure and sexual interest is strengthened, which helps maintain libido even in older age. This type of activation benefits more than just sexual life. It also positively influences areas responsible for mood, motivation, and social interaction, fostering a more engaged and emotionally balanced life. Men who regularly maintain such stimulation report feeling more energetic, confident, and connected to their sexuality, avoiding the sense of apathy or disconnection that can develop over time. From a practical standpoint, maintaining desire is also an investment in overall health and mental flexibility. Number 10. Control of reactions and increased sexual stamina. For many men, challenges such as premature ejaculation or, conversely, taking too long to reach orgasm can cause frustration and insecurity. Masturbation, when used consciously and with a training mindset, is a valuable tool for developing greater control over these reactions. When alone, a man can try simple techniques, such as interrupting and resuming stimulation at key moments, or gently squeezing the base of the penis to reduce the intensity of arousal. This private setting, free from external pressure, allows for experimentation, observing one's rhythm, and finding the ideal balance. Over time, such training strengthens body awareness and helps to recognize the signs of approaching orgasm, allowing action before the point of no return is passed. The result is greater control over the moment of ejaculation, firmer and more prolonged erections, and consequently, a more satisfying sexual experience, both alone and with a partner. You can compare this to driving a sports car. The better you know the machine and its reactions, the smoother and more precise the control becomes, allowing you to achieve maximum performance without losing command. Practical exercise for maintaining male strength and vitality. As I promised at the beginning, I will now share a simple, quick, and extremely effective exercise that will help maintain active circulation, strengthen pelvic floor muscles, and preserve male strength even after 65. This movement is an adapted version of Kegel exercises, specially selected for older men. You can perform it sitting, standing, or even lying down, without any equipment, and it puts no strain on the joints. How to perform it. Sit comfortably with a straight back, feet flat on the floor. Contract the muscles as if you are trying to stop the flow of urine. Hold the contraction for 3 to 5 seconds, without holding your breath. Slowly relax, exhaling. Repeat 8 to 10 times, 2 or 3 times a day. With regular practice, you will notice better control over erections, greater firmness, improved urinary control, and even enhanced sensations during orgasm. This exercise is quiet, discreet, and can be done anywhere. No one around you will even guess what you're doing. Maintaining this habit is like strength training for your intimate zone, helping you preserve strength, endurance, and sexual health for much longer. If you want to continue receiving science-backed information on sensitive topics related to men's health and healthy aging, so you can live life to the fullest, make sure to subscribe to the channel so you don't miss any new expert videos. Conclusion. Now you know that masturbation, when practiced consciously and in moderation, is not just a moment of pleasure, but a real tool for maintaining circulation, protecting the prostate, strengthening muscles, reducing stress, improving sleep, and preserving desire. Today you also learned a simple exercise that you can incorporate into your daily life to maintain vitality and male strength even after 65. These are easy, safe, and free actions that any man can start doing right now to take care of his intimate health. However, this information is still rarely discussed, and that's why many men don't even realize that such simple habits can improve both their sexual life and overall health. Therefore, I ask you to please share this video. Pass this knowledge on to other men your age who might be experiencing similar doubts or insecurities. Perhaps you will be the one to help someone regain confidence, well-being, and quality of life. I'll see you in the next video.